Good morning, everyone. Dr. Giselle here. Today we're going to talk about what is a safe BBL or Brazilian butt lift. Unfortunately, there have been a lot of patient deaths and harm caused to patients due to these BBL procedures. A BBL is when you take fat from one area of the body and then you re-inject it into the buttocks area in order to make a better shape and that nice round buttock. Some of the complications that can occur with the BBL procedure have been deaths. This is due to fat traveling within the circulation, within that blood supply, and ultimately ending up in the lungs and the heart. This can lead to death. These are called fat embolisms. This is when you have fat in an area of the body that it should not be in. If you build up too much fat in the heart and the lungs, that's where you're going to have a lot of problems. The heart won't be able to beat properly, there won't be blood flow to the lung or heart tissue, and that's what's caused the patient deaths. However, there are techniques in order to perform a safe BBL. There have been a lot of studies into this procedure, and plastic surgeons and cosmetic surgeons all over the world have come together in order to develop best recommendations on how to perform a safe BBL. The first thing is not injecting deep into that buttock muscle. That's where all the blood vessels are. So the veins that can be traumatized and cause that fat to go into the circulation, when you put that re-injection cannula in too deep into the muscle layer, that's where you're gonna have problems. In a safe BBL, you only inject fat superficially, so closer to that layer of the skin where there are no arteries, there are no veins, there's no way to get a fat embolism to go to the lungs or heart. Another way we perform our safe BBLs is only doing them under local anesthesia. This means we use a special numbing solution to get the entire area numb while the person is still awake. With awake-only liposuction and BBL procedures, the patient can tell you when you've gone too deep. The numbing solution does not extend down into that muscle area, so if you were to put the cannula too deep, the patient will let you know. Unlike with general anesthesia, where patients are completely asleep, they're sedated, they don't feel anything, they're unconscious, with awake liposuction, you're only going to feel pressure in the areas where the fat is going back in. But if you were to go too deep, you would be able to let your surgeon know that that was painful. Other recommendations for performing a safe BBL are using thick cannulas, positioning the patients a certain way so that you can't inject too deeply by accident. Patient positioning is also important. Where you put your incisions, all of that can affect the path of that re-injection cannula. So you can put your patients certain ways so that it's a lot safer when you're re-injecting. The goal is always to avoid deep injection into the muscle. It's also important for your surgeon to always be aware of where that cannula is going, where they're re-injecting the fat. If they're in a big hurry because they're performing 5, 8 BBLs in one day, they're not going to be as careful. So be really concerned when you get a really low price for your BBL procedure. If that center and that one surgeon is performing more than 3 BBLs in one day, it's just not going to be safe. The state of Florida even went so far as to banning surgeons from doing more than 3 BBL procedures in one day. So remember, you don't have to put yourself at risk. There's lots of ways we can perform a safe BBL with awake liposuction, only local anesthesia, using the most advanced evidence-based techniques and making sure that we inject that fat superficially, not deep into the muscle. If you've been doing research into BBLs and awake liposuction, give our office a call. We'd be happy to answer all of your questions and get you set up with a consultation with me, Dr. Giselle.